Hi everyone, I'm Randanu. I'm a junior Sri Lankan doctor who recently graduated from the University of Sri Jawardhanapura, and I was able to do my exams quite well. So I thought of sharing my experiences with y'all, giving y'all tips, and to maybe teach you a thing or two to make your life as a medical student easy. So in this particular video, I want to talk about two different things. Well, that was actually for two different things to know before you get into anything else. One is to know your goal. Are you the guy who wants to be among the best, who wants to ace your exams, get classes and distinctions, and to score big? Or are you the guy who wants to survive this whole thing, move on to the next step, and finally pass out as a doctor? Well, there's nothing wrong being either guy, is what you want, and we all should respect that. Well, why it's important? Of course, the amount of work, the amount of effort that you have to put to achieve those two or anything in between those two are different. So that's why it's important. And secondly is to know your strengths and know your weaknesses. Obviously, if you are doing medicine, you're a smart guy, you're a tough guy, you are capable of doing great things. However, even among all of us, we have our differences, we have our strengths, and we have our weaknesses. So you have to think and you have to identify what are your strengths and what are your weaknesses. If I take myself for an example, I am bad at remembering things. If I read a book and if I'm asked to reproduce what exactly I read, I would fail. I would be really bad at that. However, I am good at improvising, the logical thinking kind of things. If I'm put into a tough situation, I'm really good at using the knowledge that I have to make out a good answer and get out of that bad situation. And also, I'm good at presenting, I'm good at speaking. So I was good at all the vivas in med school. So yeah, so you have to know what are you good at and what are you bad at, and then work accordingly. So if you are bad at speaking, if you struggle presenting, you have to work on that to score big on your vivas. And if you are if you're really good at remembering, then you could read a book and keep it away. You'll remember it for the rest of your life. So you don't have to struggle remembering things. So now you know your goal, you know your strengths and your weaknesses. So then you can make a plan how much you have to work to achieve your particular goal. So when you have that sorted, it's the life as a medical student get organized and it gets easy. So yeah, that's the two things that you should know before you get into anything else. So in the next video, I would like to talk about some basic things that you should know when you are taking a history. Well, see you in the next video.